former Senator George McGovern. It's a pleasure to be here with you this afternoon. And I think it's very timely that you're in Orange County, and specifically on a day when a senator of great influence passed away, who you know very well. And I'd be curious to get your comments on the legacy you think that Senator Ted Kennedy will have left.
I think Ted Kennedy was the greatest senator of the 20th century. He was a shaping influence on practically every piece of major legislation for the last half century. I went to the Senate the same day as Senator Kennedy in 1962, and he was my seatmate for several years, so I got to know him quite well. And he was just involved in a significant way in almost every piece of legislation that we acted on.
What do you think that his biggest accomplishment would have been while in the Senate?
Well, he wanted it to be health care. That was the passion of his life. If my memory is right, he was pushing health care the first year he was in the Senate and has been pushing it ever since. I've wondered if maybe a sentiment is strong enough that the Senate might see fit now to pass a comprehensive health bill as a tribute to Senator Kennedy. I wouldn't want to bet the sink on that, but I think that that would be an appropriate tribute.
And then you personally, what are your ideas on the current healthcare debate? Do you think that we should be moving towards a public option?
I think we should take Medicare, with which we're all familiar. We know what that is. I've been getting it now since I was 65. It means the government pays your medical bills, pays your hospital bills. I think it's wonderful. And I'd like to see the same coverage extended to my children and to their children. I don't think there's anything magical about being 65 that entitles you to health care, but not at 55 or 45 or 15. So if it were up to me, I would just extend Medicare to all Americans. And that would give us a health care system roughly similar to Canada's, England, French, German, all the other healthcare systems in the advanced countries of the world.
With our current economic tumult, if you will, can we afford something like that?
I don't think we can afford not to. I think when you have close to 50 million Americans who have no health insurance, they can't afford private health insurance, and are not adequately covered by federal insurance, I think you've got a serious drag on the economy and on our society. So it's true that if you cover everybody with the so-called single-payer system, the federal government paying the bills, you're going to have a small increase, maybe a substantial increase in taxes, but you would save about $450 billion in money that's now going in premiums to the insurance companies. They're the principal block to national health insurance. They don't want to let go of a system in which they're collecting $450 billion a year in revenues under the insurance premium system. We can afford national health care, especially if we quit getting involved in these seemingly endless conflicts in the Middle East. We ought to get our troops out of Iraq as quickly as possible, and we ought not to be mucking around in Bangladesh, or not Bangladesh, Afghanistan. And that if we would take steps like that, we'd have the funds to pay for a good healthcare system.
So switching gears on to foreign policy, your prescription for the Obama administration would be to pull out as quickly as possible from both Iraq and Afghanistan.
Absolutely. I'd like to see our troops out of both those countries by Thanksgiving of this year, and then we'd have something really to be thankful about on Thanksgiving Day. What are we trying to do in Iraq now? We went in there after the 9/11 attack, knowing full well that they had nothing to do with the attack of 9/11. We've been in there now for almost 7 years, and what that occupation has done is to increase by several fold the number of terrorists in Iraq. Countries don't welcome a foreign invasion very often. Even in our own past, in this country, 13 little American colonies managed to drive the British Empire off our shores. And I think that we'd be better advised to remember lessons of that kind.
And then one final question on I guess business and economics. I know that after you left the Senate, you went into business for yourself, and there were numerous indications that your mind had maybe changed in terms of government regulation on business. Has your philosophy evolved at all in terms of what you believe the role of government is on regulating small businesses and large businesses?
Well, I have to confess, I did see some red tape and bureaucratic regulations. I thought, for example, that even the Occupation Health and Safety Act, which had a lot of good features and which did improve safety on the job, that in some cases they went too far. I also thought that there wasn't enough understanding on the part of some of the government agencies of the problems of small business. Certain lawsuits that seemed to me to be frivolous. I had a little hotel for a while, and one of the patrons got into a fight with another one out in the parking lot. They'd both had a little too much to drink, and they got into a fist fight, and one fell and hit his head on the ground and had to have medical care. That produced a lawsuit against me for not having more security personnel out in the parking lot. I think that restrictions of that kind go too far.